What if I told you that some of the medical tests your doctor recommends could actually make you sicker, not healthier? Yes, even the tests you've always thought were routine or just to be safe might be doing more harm than good. And if you're a woman over 65, chances are you've already been pushed into one of them without ever being told the full story. I've been a doctor for over 30 years, and what I've seen breaks my heart. Smart, thoughtful women getting scared into unnecessary scans, painful procedures, and dangerous medications, all in the name of caution or profit. But here's the truth. You have more control than you think. And in this video, I'm going to walk you through the 5 most overused tests in senior women and exactly how to protect yourself from medical harm disguised as care. Before we begin, I'd love to know where you're watching from and what time is it right now. Drop it in the comments below. Even if it's just a quiet moment in your day, I want to hear from you. And if this kind of honest health talk matters to you, make sure to hit subscribe so you never miss another update made just for you. Full body CT scan, to be sure. You walk into your doctor's office on a Tuesday morning in Arizona. Maybe you've had a nagging ache in your lower back or some mild discomfort in your stomach. Nothing sharp, nothing sudden, just enough to make you pause when getting up from the recliner or turning in bed. You expect a conversation, maybe a few gentle questions, or a review of your medications. Instead, your doctor barely glances up and says, "Let's go ahead and get a full-body CT scan just to be safe." At first, it sounds responsible. After all, more information is always better, right? You nod, trusting their judgment. You schedule the scan for Thursday. But what no one tells you in that moment is this, that one scan can expose your body to a radiation dose hundreds of times greater than a regular chest X-ray. That's not an exaggeration. A single full-body CT scan can deliver as much as 500 times the radiation of a standard chest X-ray. And while that radiation is invisible, it leaves a mark. Not instantly, not painfully, but quietly, and over time, it adds up. In fact, if you're over 65 and have already had multiple imaging tests in your lifetime, those radiation doses may be building inside you like layers of dust in an attic. You don't see it, you don't feel it, but your cancer risk quietly climbs. And here's the part that surprises most seniors across America, from Florida to California to rural Nebraska. The greatest danger from these scans isn't even the radiation. It's what the scan finds. Because our bodies change with age. We develop little imperfections, small cysts on the liver, a harmless nodule in the lung, a slight shadow on the kidney, all of them usually meaningless, all of them harmless. But once those incidental findings appear on a scan, a cascade begins. The radiologist writes a note. The primary care doctor gets concerned. A referral is made. More scans follow, sometimes a biopsy. Sometimes even surgery, all for something that would never have harmed you in the first place. You went in for a mild backache. 6 weeks later, you're lying in a hospital gown recovering from a procedure that you never needed. I once had a patient in New Jersey, 72 years old, who went through exactly that. Her scan picked up what turned out to be nothing more than a bit of scar tissue from a decades-old infection. But before she got that answer, she endured 3 tests of painful biopsy and weeks of sleepless nights. Why does this happen so often? Why are older women in America being pushed toward full-body scans when they don't need them? There are a few honest reasons and a few uncomfortable ones. Sometimes it's defensive medicine. Doctors are afraid of missing something, of getting sued, so they order the scan to protect themselves. Other times it's money. Imaging machines are expensive, and clinics that own them often want to keep them busy. And then there's time. Really listening to a patient, reviewing their history, asking the right questions, that takes time. Ordering a scan that takes 10 seconds. But you're not a number, you're not a checklist. You deserve care, not shortcuts. If a doctor recommends a full-body CT just to be safe, you have every right to pause and ask questions. Say gently but firmly, what are you looking for exactly? If the scan finds something unexpected, what will we do next? And most importantly, will the benefits of this scan really outweigh the risks for someone my age and history? You see, knowledge isn't just power, it's protection. And when you're over 65, especially as a woman, medical decisions become more nuanced, not less. The healthcare system in the United States is complex. But what's simple is this: you deserve transparency, you deserve informed choices, and you deserve to feel safe without being over-tested. So before you say yes to a scan you don't understand, take a breath. Ask a question. You're not being difficult, you're being wise. And that wisdom, the kind that comes from years of life, love loss, and learning, is your greatest tool in protecting your health. Annual bone density measurement. Every year across the United States, millions of women over 65 go through a familiar routine. They visit their doctor for a regular checkup, step onto the scale, check their blood pressure, and then almost without discussion, they're told it's time for another bone density scan. You might be one of them. You nod politely, you trust your doctor, and you assume that if they're recommending it yearly, it must be the best way to keep your bones strong. But here's something you may not have been told, something that surprises many smart, proactive women all over America. You probably don't need a bone density scan every year. Not if your last result was normal or only slightly low. Not if you haven't had a recent fracture or major medical change. You see, bone loss, what doctors call osteopenia or osteoporosis, doesn't happen quickly. It's not like catching a cold or even seeing your vision change from month to month. Bone loss is a slow, gradual process that unfolds over many years. Think of it like a tree aging in your backyard in Wisconsin or Georgia. You don't measure how much taller it's grown every spring. You look at it over time. That's exactly how we should think about bone density in older adults. Science supports this too. According to guidelines from leading medical organizations in the U.S., including the National Osteoporosis Foundation and the U.S. Preventive Services Task Force, bone density tests are generally only needed every 2 to 5 years, depending on your individual risk and your last result. So why are so many senior women still being told to come in yearly? Why are these tests being ordered like clockwork, even when the data doesn't support it? The answer isn't always easy to hear. In some cases, it comes down to habit. In others, it's profit. Many clinics across the country now own bone density machines, and every scan brings in revenue. When the equipment is already there, the temptation to keep using it grows stronger. Sometimes doctors themselves are under pressure. They work in fast-paced offices from Los Angeles to Minneapolis, juggling insurance rules, clinic goals, and electronic health records that flag gaps in care if a scan hasn't been ordered in a while. In that swirl of pressure, your personal needs may get lost. But here's where it gets even more concerning. Let's say you do have that annual scan, and the result shows a slight drop. It's not alarming, maybe just a small shift, something completely expected as we age. But instead of reassurance, the doctor says, let's start medication just to be safe. And that's when the real trouble can begin. Medications for bone loss like Fosamax or Beniva are commonly prescribed to older women throughout the United States. But many people don't know that these drugs come with serious side effects, especially when used without clear indication. They can cause jawbone necrosis, a condition where the jawbone begins to decay. They can lead to spontaneous fractures in the thigh bone, ironically the very thing these medications are meant to prevent. Some women report severe gastrointestinal pain that lasts for years. These are not rare horror stories, they're documented risks. And yet so many women are never given the full picture. They're told your numbers are down, this is what we do. And out of fear of falling, fear of fractures, fear of aging, they say yes. But you deserve more than fear. You deserve facts. You deserve time. You deserve a voice in the room. The next time your doctor suggests a bone density test, especially if it's been less than 2 years since your last one, here's what you can say. Has there been a change in the official guidelines that I should know about? If the result comes back slightly lower, what exactly will change about my care? Is this truly necessary for my health, or is this part of a routine that benefits the clinic more than it helps me? These are not confrontational questions. They are wise, respectful, and grounded in your right to understand what's being done to your body and why. Because aging in America today isn't easy. You're asked to navigate a maze of health plans, specialists, screenings, and side effects, all while trying to stay independent, mobile, and mentally strong. But knowledge is your anchor. It's what helps you decide when to say yes, when to say no, and when to say, tell me more before I agree. Your health is not a business plan. It's your life. And you have the right to protect it slowly, wisely, and on your own terms. Asymptomatic electrocardiograph EKG. You sit in the exam room in your doctor's office just like you've done every year. You feel fine, no chest pain, no shortness of breath, no dizziness. You're here for your routine physical. Maybe it's in a small clinic in Ohio or a large medical center in Phoenix. Your blood pressure is good. Your labs were stable last time. Then the doctor says almost casually, let's go ahead and run an EKG while you're here. You pause for a second. You're not sure why. You didn't come in for heart problems. You didn't mention any symptoms. But the doctor seems certain, so you nod. It feels like the right thing to do. Because in American culture, more testing often feels like better care. We trust that if something is offered, it must be helpful. It must mean the doctor's being thorough, right? But here's what few people will tell you. If you are an older adult with no signs of heart disease and no risk factors, a routine EKG may do more harm than good. That may sound surprising, even upsetting, but it's backed by solid science and recommendations from top U.S. health organizations like the American College of Physicians and the U.S. Preventive Services Task Force. You see, EKGs are designed to detect problems in the heart's electrical system. They're useful if you have chest pain, palpitations, or a known heart condition. But when used on healthy people with no symptoms, EKGs often pick up tiny irregularities that are harmless things like minor rhythm changes or slight deviations that mean nothing. Here's the problem: once something shows up, it's hard to ignore. The doctor sees a blip. They worry. They order more tests. A stress test may be an echocardiogram, sometimes even a cardiac catheterization, where a tube is threaded through your artery into your heart. And now you've gone from healthy to heart patient without ever feeling unwell. I once spoke with a 68-year-old woman in Kansas City who had this exact experience. She felt great. She walked every morning and volunteered at her church. Then one routine EKG led to 6 months of test medications and restrictions. She told me the hardest part wasn't the tests. It was feeling like I was suddenly sick even though I felt strong before. And that's what many older Americans are going through quietly, a shift in identity from healthy to fragile just because of a machine. This isn't just about the physical impact, it's emotional. When you're labeled with a heart issue, even a minor one, it can change how you see yourself. You may avoid movement out of fear. You may feel anxious about every flutter, every skipped beat. You might start medication you didn't truly need, and that can bring its own side effects. This is not to say EKGs are bad. They can be life-saving when used in the right context, but screening healthy older adults with no symptoms and no risk factors, that's where we must pause. So what can you do if your doctor suggests an EKG during a routine visit and you feel, well, you have every right to ask questions? Start with, do I have any specific risk factors that make this necessary today? Follow up with, if this test comes back normal, will it change anything about how we manage my care? And if the answer is vague, something like, it's just routine, or better safe than sorry, you're allowed to say no. You are not being difficult, you are being wise. Because good healthcare isn't about doing more. It's about doing what matters and doing it well. In America today, seniors are juggling more medical advice than ever before. But amid all the noise, the most powerful thing you can do is slow down, ask why, and protect your peace. PAP smear and gynecological examination after age 65. If you're a woman over 65 living anywhere in the U.S. from a small town in Iowa to the heart of San Diego, you've probably been told to keep up with your checkups. You've been a responsible patient for decades. You've done your mammograms. You've gone in for pap smears. You've followed instructions, stayed on top of your health, and trusted the process. But now you've entered a new chapter of life. You've reached retirement. You've seen your body change in quiet, slow ways. And still at your annual visit, your doctor says, let's go ahead and do a pap smear just to be safe. You hesitate for a second, but maybe you don't say anything. Maybe you think, well, it must be important if they're offering it. So you put on the gown. You go through the procedure. But what if I told you that in most cases, pap smears after age 65 are no longer necessary, not just unnecessary, but potentially harmful? That's not my opinion. That's the official recommendation from trusted sources like the U.S. Preventive Services Task Force, the American Cancer Society, and the American College of Obstetricians and Gynecologists. Here's what they all agree on. If you're over 65 and you've had 3 normal pap smears in the past 10 years, or 2 normal HPV tests, you can stop screening. Unless you have a history of cervical cancer or a condition that puts you at high risk, continued testing doesn't add benefit. It only adds burden. So why does it keep happening? Sometimes it's habit. Doctors get into routines, the exam is booked, the box is checked, and no one questions it. Other times it's because your doctor simply hasn't kept up with the latest guidelines. And sometimes, let's be honest, it's because older women in America are too often seen as quiet, compliant, and unlikely to push back. But here's where it gets serious. When pap smears are done in women post-menopause, the cervix is more fragile. The tissues thin out. Natural changes occur. These changes can cause false positives, abnormal readings that aren't cancer, but look suspicious on the surface. And once that happens, the chain reaction begins. You're referred to a specialist. You're scheduled for a colposcopy, an invasive, uncomfortable procedure where the cervix is magnified and examined. Maybe even a biopsy where a small piece of tissue is removed. I once spoke with a woman from North Carolina who went through this. She was 72, healthy with no symptoms. After a routine pap smear came back abnormal, she endured 3 follow-up visits, painful procedures, and weeks of worry. In the end, the result was normal aging tissue, completely benign. But the emotional toll stayed with her much longer because this isn't just physical. It's emotional. It's vulnerable. It's deeply personal. For many older women, pelvic exams bring discomfort not just physically, but psychologically. They can trigger feelings of exposure, anxiety, even trauma, especially after menopause when vaginal dryness and thinning make the procedure more painful. And yet, even when women explain that they've had years of normal results, even when they mention that they're no longer sexually active, some doctors still push ahead with phrases like, "It's just routine," or "better safe than sorry." But let me say this clearly, better safe than sorry is not science. It's a slogan, and fear should never be the reason you're pressured into a test. So what can you do? The next time this comes up, and it might ask your doctor, am I still at risk based on my history? Do the official guidelines recommend this test for someone my age? What happens if I say no? You might be surprised at how many times the answer is, actually, you're right. Because here's the truth, you are not irresponsible for saying no. You are informed. You are wise. And you have every right to protect your body from unnecessary procedures. In today's healthcare system in America, it's easy to get caught in cycles of over-testing. But there's power in knowing when to say enough. There's freedom in asking for care that fits you, not just your chart. Your voice matters in the room. And the older you get, the more important it becomes to use it. PSA for husbands, a dangerous trap. If you're a woman over 65, chances are you've spent a lifetime caring for the people around you. You've helped raise children, supported family through illnesses, And more than once, you've probably sat in a doctor's office beside your husband. You're used to asking the questions he forgets. You take the notes. You remember the dates of past procedures, and you gently speak up when he won't. And if you're like many women across America, from Texas to Michigan to the coast of Oregon, you've probably asked a doctor, should he get checked for prostate cancer? It's a caring question. It comes from love. But sometimes even the most well-intentioned question can start a chain reaction that leads to pain, regret, and a lifetime of consequences. Let's talk honestly about the PSA test, a simple blood test that's often offered to screen for prostate cancer in older men. You may have heard it described as routine, quick, or preventative. But here's the part many doctors forget to explain. For men over 70, PSA testing can do more harm than good. You see, PSA stands for prostate-specific antigen, a protein made by the prostate. Elevated PSA levels can be a sign of cancer, but they can also be caused by completely benign things like an enlarged prostate, a recent infection, or even just riding a bicycle. In fact, the test is so nonspecific that false positives are extremely common. A slightly elevated PSA might mean nothing, but once the number comes back, flag, the alarm bells ring, and then the next steps begin. Usually a transrectal prostate biopsy is recommended. That's an invasive procedure where a needle is inserted through the rectum to take tissue samples from the prostate. It's uncomfortable. It carries risks of infection. And more importantly, it can uncover slow-growing cancers that would never have caused a problem in your husband's lifetime. But once the word cancer is spoken, everything changes. Even when the cancer is small contained and unlikely to spread, most men feel pressured to act. They hear cancer and they think fight it. They agree to surgery or radiation out of fear, not necessarily out of medical need. And here's what happens far too often in the United States, from Florida, retirement communities to veterans clinics in Ohio. A man who had no symptoms, no complaints, and was enjoying his daily walks and backyard barbecues now faces a new reality: urinary incontinence, erectile dysfunction, chronic pelvic pain, side effects that can be permanent, and all because of a cancer that might never have harmed him at all. I remember one couple from Colorado Springs. She brought him in just to get checked. He was 76, still hiking in the summer, still driving his RV across the country. His PSA was slightly elevated. 6 months later after surgery, he was wearing adult diapers and couldn't sleep from nerve pain. And he said to me with tears in his eyes, "I wish I'd never taken that test." So why are we still doing this? Part of the reason is fear, part is habit, and part is because no one tells caregivers, especially wives, what questions to ask before that blood draw. That's why I want to offer you a different path. The next time a doctor brings up PSA testing for your partner, or the next time you think about asking for it, pause, take a deep breath, and ask these 3 questions gently but firmly. If the PSA is positive, what exactly are the next steps? Will this cancer, if it exists, even cause harm during his lifetime? What are the possible side effects of the treatments you'd recommend? These are not confrontational questions. They are protective. They come from wisdom. The U.S. Preventive Services Task Force recommends against routine PSA screening in men over 70. And many experts argue it should only be used when symptoms are present or when there's a strong family history. Otherwise, the test opens the door to unnecessary suffering. In American medicine, we've often been taught that more is better. But in older adults, especially men over 70, doing less can actually mean doing more to protect quality of life. So don't let silence or politeness stand in your way. If you're supporting your husband through healthcare decisions, your voice is powerful. Use it to ask. Use it to protect. Use it to ensure that medical care doesn't just extend life, but help preserve the life he loves living. So here's what I hope you remember. Taking care of your health doesn't mean saying yes to every test. It means knowing when something truly helps and when it's okay to say no thank you. That choice doesn't make you selfish, it makes you wise. You are not just following instructions. You are leading your care with clarity and calm. These tips are shared for general awareness. If you have any health concerns or symptoms, be sure to speak with your doctor before making any decisions. Now I'd love to hear from you. What part of today's message stayed with you? What would you tell a friend after watching this? Or if you're not sure what to say, just type the word hope in the comments below. Sometimes one small word is all someone else needs to see. And if this video helped you, don't forget to hit subscribe, turn on the bell for updates, and share it with someone you care about. Wherever you are, whether you're sitting by the window in a quiet Midwest town or sipping coffee in a sunny Florida kitchen, I'm wishing you peace, confidence, and good health ahead. Take care and see you next time.